So the topic is about the vectors that are used in the embryonic stem cell method. In the embryonic stem cell method, the vectors are inserted into vectors are used to insert a transgene in a genome of a mice or any animal. But in this case, we are only talking about mice. So we consider the possibilities of a vector that has the transgene inserted into it. So there are two outcomes, that is, either it could get inserted or it could not get inserted at all. So if it is not getting inserted, then we will say that there is no insertion, okay? And if there is an insertion, there might be two possibilities or two ways in which it could get inserted. That is, it could get correctly inserted in its actual target site, that will be a homologous recombination, while if it is getting in the non-target site or a spurious site, that is anywhere which is not a target site, then we will call it as a non-homologous recombination or non-specific integration. Out of this three possibilities, we have positive negative selection. Okay, so if there is insertion, then we would say that it is positively selecting the cells, and if there is no insertion, then if there is no insertion, then it will be positive, and if there is insertion, then out of this insertion, the target one will be selected negatively. So we will come to that. Now, for this selection, the vectors that are used have four components. Out of that four components, two of them are markers. So the first component is a DNA sequence. There are two blocks of DNA sequence, namely HB1 and HB2. The second factor is a transgene or a gene of interest, which will be called as a transgene or TG, denoted as TG. The next is a gene, that is neo-R-gene, which stands for neo, resistant to neomycin drug. It provides a resistance to the compound G418, which is present in the neomycin drug. The next component, that is your last component, is again a marker gene. This gene is called TK gene or TK1, TK2. It is a component of your TK gene. TK stands for thymidine kinase. Since it is present in herpes simplex virus, it is also called HSV, TK1 and TK2. Now, out of these four components, two of them are your markers. Let's see how they work. Now, if in case you have TK gene, so TK gene usually provides sensitivity to the organism to the compound jancyclovir. So, if this TK gene is present in the organism will be sensitive to ganciclovir and it will die in the presence of ganciclovir. So, if the TK gene is not present, the organism can survive if ganciclovir is present. While the opposite scenario is for the next gene, that is your neomycin gene or neo-R gene. So, if you have neo-R gene, it will provide resistivity to the organism. So, if the organism have neo-R gene, the organism can provide resistance to the neomycin drug if it is present in the media, and it will survive. So, these two markers kind of play a very important role in the selection. So, the first type of recombination is your homologous recombination. So, we will first see how the non-homologous recombination happens. So, non-homologous recombination does not happen between the homologous sequence. So, it will get integrated as it is. So, your four components that is present in your vector gene gets incorporated into the genome of the mice as it is. So, that will include your homologous sequence, your T gene, your neo-R gene and your TK gene as well. While in your homologous recombination, because of the homologous recombination, it will happen in between your homologous sequence. Since the homologous sequence only consists of your neo-R gene and your TG or your transgene, your TK genes are outside your homologous sequence. So, whatever components are present in between the homologous sequence, they get incorporated into the genome of the mice with the help of a double crossover mechanism. So, because of this type of recombination, your TK genes are excluded from getting incorporated into the genome of the mice. This kind of plays a very important role. So, at the end of the recombination, the cells are grown in the media, that consist of both Chancellor and neomycin. Now, when cells are grown in Chancellor and neomycin continuum media, there will be three types of result. So first, if there is no exhaustion, it will not have decaying as well as neomycin. Then, if it is inserted in the spurious site, then it will have both the decaying and your neoarginine. While if it is inserted in the target site using homologous recombination, then it will only have neoarginine and it will not have decaying. So let's see what happens at the end. So at the end, what happens is, if there is no insertion, no gene is present. So since there is no gene present, it will have the drug in the media. Okay, so the drug in the media, that is your neomycin, will be there and the organism won't be able to resist it, so it will die. This type of selection of the cell is called positive selection. While if there is an insert but at the target site or your non-target site, the cell will either have decaying or will not have decaying. So if the cell has decaying, it will be sensitive to your Janus-cyclovir. If it is sensitive to Janus-cyclovir, it will die and will not grow in the medium. While if there is no decaying, it can grow in the media because there is no sensitivity and it has resistance against Janus-cyclovir, against neomycin, and it can grow in the media. So this type of selection is called negative selection. So in this scenario, we insert the we insert the transgene in the vector and then integrate into the mice genome and then try and select the cells which has a proper insertion at the target site using positive negative selection.